Good morning, good afternoon, good evening, and good night, friends and colleagues from across the world. Welcome to our second session Podinar today. It's actually a special session Podinar where we are reaching out to our dental colleagues across the world to discuss a very important topic, office-based oral surgery for the general practitioner. As you may know, one of the driving factors in a dental practice is pain. Patients frequently present to our practices with pain where we often need to render immediate care, such as sometimes opening up the tooth and relieving the pressure, or rendering care as to oral surgery and extraction if non-restorability is established. Many of us don't get good training in our professional schools. So we brought together a group of doctors that implemented and instituted the International Excision Academy. And two of the faculty members are with us today, which I will introduce shortly, Dr. Carlos Morao and Dr. Thomas Wiedemann. And this session will be hosted by Dr. Kevan Javid. Thank you, gentlemen, for joining us.
You're welcome. Thank you, Dr. Shah, for the kind introduction. So today we have our Dr. Wiedemann and Dr. Morao. Dr. Shah, can you please put out the flyer that we have for this course so I can explain a little bit about it?
Certainly.
So Excision Academy started about 8 years ago, 2013, and we've been doing these seminars pretty much throughout the year, and they've been growing. Last time we did them in 2019, we had almost 16 different classes all over the USA. So in 2020, because of the COVID, we kind of slowed down and we didn't have any of these courses. But this year, we're starting slow, and we have a few of these courses in Los Angeles area this year, and we have a special for everyone who wants to join us on these courses. You guys actually get this really great deal that is 50% off, and you have to use this code AOS 2021. Now, I've been in these courses many times with Dr. Wiedemann and Dr. Moran. These courses are basically kind of take you from the very basic to very advanced. Obviously, Dr. Wiedemann, he's known for the man of the complications. So if if you ever any type of work we do in the dental office, I believe that it's not how you do things, it's more about how to do when things don't go right, and then that's when you have to change your plan or plan B, or what we're going to do at this point. If say, for example, you're doing an extraction and you can't take the tooth out, and then what do you do? So so that's basically the idea of this, the main idea of this course, where you'll know all the techniques and the procedures that you should be doing, and all the ones that you shouldn't be doing, and when you refer, and all the complications that you could have, basically, if you're not paying attention and seeing those details that we need to look at operatively, where we look at an X-ray when we need a panel or we need a CT scan. So welcome, Dr. Wiedemann and Dr. Morao, to our program. Thank you.
Thank you much. Thank you very much for having me. Thank you, Dr. Javid.
Perfect. So here again, it is. We also have our Academy of Oral Surgery, where we have many online courses that you guys can take, and you can basically become a member for 1 year free membership of AOS. Again, this is another we're doing these things because of the COVID, and we're trying to help our colleagues out. We're giving them another year of free membership. There's a lot of benefits in becoming a member at AOS. You get a lot of CE units for free. Pretty much, the only thing you pay for is if you need to get the CE units, you can get the CE units. But the continuing education, as far as the knowledge base, is also free. We don't charge you for that. Just recently, we increased about another 500 new members to our academy. So we're very proud of that. And again, if you guys want to register, you guys go to oralsurgery.org/register, and then you just put in the global summit at the checkout to get that special registration coupon. And thank you, Dr. Shah, for showing that. So you're
any of these categories, Dr. Javid, would, if they click on it and pick what category they fall into, because we're open to all dentists and specialists at the academy, at the checkout, when they use that code, we'll waive all of their fees, and then they can come back to the Extraction Academy site, which is the AXT Academy, and under its registration page, they can click for the two upcoming upcoming workshops that we're test piloting. As you know, the United States doing very well with the vaccinations, and people are getting out, and we're starting to see signs of some kind of normalcy again. We're going to start in Los Angeles, where we have the easiest transport to and most populated scenario with dentists, to start getting them back out. And then we'll follow that up with a second one in Irvine, and hopefully back in 22, we will be on our normal schedule, where we go to all the football cities and continue bringing this much needed information and knowledge to our colleagues. So basically, they register here, and then they can use that code at the time of checkout to be able to benefit from this 50% discount on the wonderful workshops that Dr. Wiedemann is conducting. And perhaps you can give a little background about our two triple doctorates that are conducting the sessions.
Yeah, thank you, Dr. Shah, for sharing all that. So yes, of course, Dr. Wiedemann has a triple doctorate in oral surgery, and Dr. Carlos, he's obviously an oral surgeon and a PhD, and he has a couple of masters in oral surgery, and so very knowledgeable in this this field. So I'm gonna go ahead and ask some questions, basically kind of bring out what the people would get from this course when they take it. So I'll ask you, Dr. and Dr. Carlos, different questions. So Thomas, and I've been to your courses, and I've seen you know, how you do this lecture. So tell me about what's your advice would be to tell a dentist, like, so if you're gonna do an extraction, tell me about, like, what are the most important things that you would recommend to a dentist who's doing extraction that they should avoid or they should do?
I think one of my strongest advice is, if you go into oral surgery, never forget that oral surgery is surgery, and that also means start to think like a surgeon. That means before we do it, I strongly recommend that really have a plan. It's evaluate your patient from the medical aspect, from the dental aspect, and try to kind of visualize the entire procedure. That means also try to visualize what kind of complications can happen, and am I prepared to tackle them if they appear? Do I have all the instruments available? Do I have the knowledge? Do I have the skill set to handle these complications? And then everything, of course, it starts with an intraoral exam. It also starts with a proper radiographic evaluation, and then you do the procedure according to our surgical guidelines. And if a complication happens, as I said, it's all about being prepared. And that's part of the course. It's basically all the afternoon is about how to prevent complications, how to recognize them early enough and properly treat them. I think that that's my main message to our dental community.
Absolutely. Thomas, recently I had to renew my IV sedation license, and, going through all that emergency protocols, when I look back and I see that's not just for the IV sedation, honestly, or just for oral surgery. Everything we do with dentistry, all these little things that we use, most of the time, most dentists are not even, checking patients' blood pressure, say, for example. They're not, they're not even aware that the patient might be having an, they haven't been to the doctor for many years. If they haven't taken care of their teeth, obviously they haven't taken care of their health as well. So a lot of these patients need the guidance, and so it's very, like you say, it's very important to know what to do. Absolutely. And know the medical history. And absolutely, I agree with you there. So tell us a little bit about oral surgery. As far as is there any recommendation for you as far as the type of extraction that people should do when they, and then what do they learn from your course? Say for example, like say, I don't have any experience doing extractions. So what do you recommend me to do? And when I take your course, what would I take from that?
Oh, okay. Thank you for that question. Actually, for all of you who are planning to attend this course, I don't expect anything. The more knowledge you have, the better. But usually I start that course with the basics. So we review, let's say, the principles of traditional exodontia. Then I also will go into more atraumatic techniques, but I will also address surgical extractions, all the procedures which are necessary to get the tooth out and when to use what. And nowadays, since extraction is not everything, I will also address the fact of, and the big field of socket management, what to do with the patient after the tooth is out. Because nowadays it's not only about getting the tooth somehow. No, it's getting out the tooth properly, as atraumatic as possible, and prepare the patient for the next step, which is nowadays most likely an implant placement, whether on an immediate protocol or on the delayed protocol. The same I do with other office-based surgeries. Simple procedures everybody can learn. You don't need any previous knowledge. I will show you everything. This includes also basic techniques, socket preservation, some basic techniques when it comes to GBR procedures, all these kind of things which are necessary around a tooth extraction. And of course, as we mentioned before, in the afternoon, I basically address complication management, and all this is bedded into 2 sessions of really hands-on training. So we really not only talk about these subjects, we really practice that.
Yeah, and then I'd like to talk to, because we will talk about the surgical anatomy, and then local anesthesia, that's very important. And for sure, the question about the flaps and the blood supply for them.
Perfect. So perfect. So Dr. Morale, let's go. Let's ask you. I would like to ask you this question as far as socket preservation. I know you are very actively. You've published many articles in the field of PRF, and so as far as the socket preservation, tell us about your recommendation for socket preservation. If somebody is doing an extraction, and let's say somebody is worried about, for example, dry socket. I mean, that's one of those things that, believe it or not, a lot of patients, they're worried about that, because now, with the Google and with all this information out there, people, they know a little bit, so they read all this stuff and they figure out, okay, yeah, what's the most complication with the extraction? And they talk about dry socket. So tell us a little bit about dry socket and say, PRF.
Yeah, about socket preservation, I think right now we don't have something like a gold standard for that. We can use biomaterials, bone substitute for sure. But I can say right now that we don't that the PRF is not an option for socket preservation. Not the regular PRF, okay. And but for sure the PRF is a good. And then I will explain it during my presentation. PRF is almost, I think that's the best option to prevent the dry socket. And then that's my recommendation for all of my third molar extractions for all of my patients. I think that's the best thing that we can do for all of them.
Right. So basically, I mean, but you would, like you would obviously discuss what, like it's not for every case we need to place the PRF in if we can, like for example, so if somebody is doing extraction, I wouldn't say like you're going to place a PRF in every socket that you're going to extract, right? So, but you will discuss in these courses when you would do it, right? Obviously,
Yeah, for sure,
what to
especially.
look for, and when is the case that you think is absolutely necessary to
Yeah, for sure, especially in the case of third molar extractions. I think that if you have an option to do the best for our patients, I think that we need to deliver it for them.
Right. Thank you. And so, Dr. Wiedemann, I know you're at New York University, and you train a lot of obviously dental students and other doctors. Tell me how like when I graduated from dental school, maybe I'd extracted 20 teeth or something like that, right? 20 teeth, 25 teeth, and really, so when the students or doctors get out of the school, they don't have much experience, right? I mean, that's still the same, right? That hasn't changed, right?
Exactly. Although I think NYU is still providing a pretty good surgical education. So the requirements used to be like 40 extractions. Well, with all the COVID problems and the restricted access to buildings, the requirements couldn't be fulfilled by all of them. But in general, I think they're doing pretty well. But overall, just by having extracted 20 or 30 or 40 extractions, you're still not comfortable doing this. And exactly, and that's exactly where the course starts. I expect in my experience to the last, compared to the last couple of years where I was doing these courses, there's always a good amount of, let's say, freshly graduated dentists or dentists in their first years of experience after graduations who are now familiar doing all kinds of procedures, and now they want to go a bit deeper into surgery. So I really take them from there, from how they left dental school. And then we develop more knowledge and more skills. So the typical dental student graduates with some kind of profound knowledge in non-surgical extraction techniques. Some of them may have done one or two surgicals, the majority, unfortunately, not. So I take it from there and show them, okay, that's how you can do your non-surgical extraction even better than before, or if necessary, that's how we do a surgical extractions. And these are techniques how to refine your surgical skills and your surgical extraction technique. And all the knowledge and skills you need to minimize and to control complication. That's also a problem, because if you only have extracted, let's say 20, 30 teeth in your dental school, you are definitely not familiar and not good enough to do a proper complication management, because you haven't seen them too often. So,
I totally agree with Dr. White.
That's pretty much my point, that it doesn't matter whether you have 20, 30, or 40 extractions. You have, most of them have literally no experience in active prevention of complications and proper treatment of complications, just due to lack of experience. That's the point. So it doesn't matter. We are not talking about 10 extractions more or less. I think no dental school is really capable to provide an adequate amount of extraction, so anyone can possibly prepared for that. That's pretty much where I take them from.
Yeah, absolutely. And you know,
and then not only in the US, everywhere.
Of course,
anywhere.
I don't limit that to the United States. Absolutely.
Yeah, no, of course. You know, this course, obviously understand that this course is not to produce oral surgeons. This course is to inform general dentists who are not comfortable with oral surgery procedures, how to proceed, how to stay safe, you know, and how to basically, you know, this our first duty is to do no harm, basically, to the patients, right?
It's about know your limits.
I mean, the numbers are staggering, guys. You look at
this is how to evaluate that patient preoperatively. Is that my patient? Can I do it safely? Or is that rather a case which looks complicated due to the clinical evaluation and due to the radiographical and medical evaluation? Because all these three things are ultimately factor in to the fact, can I do this procedure today safely on that patient? So this is also part of it. Definitely the key part.
For sure.
Sometimes it's better not to do it, to refer it prior to any complication. That really know your limits. That's pretty much the message of the entire course. And if you think this procedure is within your limits, do it properly. And if it still happens, act properly. And ideally prevent it. I think Dr. Morao and I can agree on that. That's the purpose of that course. Of course, we will not be able to make an old surgeon out of every in one day, but it should help to create some kind of the entire approach to an extraction. This will be definitely different after people have attended that course. It's reduced fear. It's like some things are just very fearful when it comes to extraction, but there is no need to be fearful just because there is a chance of complications. If you are trained, if you have good knowledge, there is no reason to be fearful. It's rather really know your skills, know your knowledge, and act properly. That's, I would say, my major message to our students and attendants.
And I know you guys, when this course, the way you guys hold these courses, you start with the basic, and basically you go through all the steps, and you also introduce all the instruments and the history and what they should use for every type of extraction, and again at the end, talking about the complications and what they should do and what they shouldn't do, and then also hands-on, they get a good experience of what, how to extract, how they should extract it to, then what type of instrument, how they should hold it and all that. And being a general dentist, I know very well that, regardless of how much training you get, in school for any field in dentistry, none of them is sufficient for you to, to do anything. You're just gonna have to practice. That's what it's called, practice, right? You get out and you practice, and then but the most important thing is to know how to do a safe practice, right?
For sure.
Let's say, for example, if you're doing oral surgery, you got to be aware of packing the throat, say, for example. But that's also true for anything else, for delivery in the crown, or working, working with little things in the mouth, so everything can fall in the back of the throat. So again, the safety measures, they can apply to all fields of dentistry. But I appreciate the thoroughness of this course, where you guys cover everything. So, Dr. Carlos, as for the flap, we talked about flap design and blood supply management and all that. So tell us a little bit about that. How much do you cover in this course for? You talk about the anatomy, the location of the important arteries and the nerves, and where they should flap, how far they should flap, and
Yeah, we will talk about the surgical anatomy, and then how you can do the a safe flap, a safe procedure for all of the patients. And then I totally agree with Dr. Wiedemann about the question, especially the limits for the surgeon, for the dental surgeon. The dental surgeon needs to know about his limits, and then that's the most important thing when you start to think to do a surgery in your office. And then I think that's when you combine everything about the medical history, as he said, medical history, the armamentarium, the surgical anatomy, and everything that you need to know for safe extraction, we will bring inside of this course. And then that's why we are preparing an excellent course to do. It will be next month. If I am I right? Next month or
Dr. Shah, can you put out that flyer for us one more time?
Which, yeah. So couple of points as to the ones that were made, and I'll get the flyer up momentarily here. Let's go ahead and go here. But what I wanted to also reflect upon what was said, why we have done this. There is over 2.5 billion people that need some kind of oral surgery care and struggle with some kind of edentulosism, even if it's one tooth. There's simply not enough skilled dentists to care for them, and certainly not enough specialists out there. So, and over the years, our philosophy about exodontia has changed. We now look at post-extraction prosthetic treatment. So we don't just yank teeth out and try to get the roots out by all means necessary, but we try to do minimally invasive extractions. There's no such thing as atraumatic extractions, but minimally invasive extractions with keeping in mind of our buccal bone. As much as our buccal bone is important to us, that is, as the crown margin is to the prosthodontist, we want to preserve that buccal bone. We want to do proper GPR. We want to set that patient up to be able to later possibly get implant treatment or other kind of prosthetic treatment. So I think that the world has changed. There's so many new techniques coming out, new consensus, for example, coming out of New York University often about coronectomies and other surgical procedures that we discuss at this course. So if any surgery interests you, this course is for you. For me, it started with extractions. In dental school, I was excited to go in and clock into oral surgery and get more and more teeth out. And then 2 years later, I got involved with implants. Now 90% of my practice is implants and exodontia and full mouth rehabilitations and things of that sort that I do now. So you can build a career around it and use this tremendous professional advancement opportunity to care for your patients, but particularly having it from specialists like Dr. Wiedemann and Dr. Morao, you don't have to go into an oral surgery program to get the gist of what you need for office-based oral surgery. But Dr. Kevan, is this the flyer you alluded to?
Yes. Yeah. So our first.
Yeah, almost next week. Yeah.
Yes, it's
Next week, no,
July
next month, yeah.
31st, Saturday, July 31st. That's in, and then Ranch Cucamonga, and then the next one is Saturday, September 25th in Irvine, California. So, and wanted to also talk about Dr. Wiedemann as a part. You do a portion where you do grafting and membrane placements and all that in this course. So
absolutely,
yeah.
As I already mentioned, it's not only about getting the tooth out; it's also about the socket management. So yes, evaluate the extraction socket. Is my socket compromised or not, and how to handle that on site in the same session. It can end up in that we are not doing anything. It may end up in a pure socket preservation, but it also may end up in a GBR. So yes, we're going to talk along with Dr. Murray about safe lab designs, predictable results, what you can do.
Yeah.
There are so many techniques out there, and materials and membranes and PRF. And the key is about what kind of procedures can I do in my office, which is predictable and also which is affordable. We see that here in New York City every day. The level of affordability is quite different. And so you have to be able to offer different kind of techniques and still maintain a good situation for the next step. That's the key. But really have a look at the next step of this patient. That most likely it's going to be a bridge, it's going to be a denture, it's going to be an implant placement. So this is part of the extraction treatment that we have, and we really focus on what's going to be our next step, and already prepare that next step while we are doing this extraction. Yeah. So definitely yes, flap design, safe flap design, selection of biomaterials, yeah, and evaluation factors of how to obtain a predictable result.
Yeah, and then another thing that I like to say, I agree with Dr. Shah, because he said something about the atraumatic surgery, and then I don't like this term. I don't like to say atraumatic because we always have trauma in that area, and then I like to say less traumatic surgery. I think that's the perfect term for that.
I agree. I don't like that term atraumatic. There is no such thing.
Yeah.
Minimally invasive, guys.
Or minimally traumatic surgery. There is
Or
How does
minimal
topics
invasive. Minimal
are-
invasive is good.
You like that one?
Unless
Minimally
you-
invasive.
Yeah, unless if you're a magician. You're a magician.
Yeah,
you
for
can do
sure. You're a
atraumatic.
magician. Boom.
I get this request almost every day from students. Oh, teach me atraumatic extractions.
No, that's impossible. I'm not a magician.
Possible.
Boom.
How to take it out with a minimum amount of trauma, but atraumatic.
Yeah.
Maybe that works on another planet, not on this one.
Yeah, for sure.
Yeah,
Yeah,
I hear that one in literature now too, but as you guys know, it's not. But for people that are in the vicinity of California, I think it would be wise to come out. It's an 8-hour CE. It will apply for your licensure renewal as part of your hands-on type requirements that you have. And it's a great fun that we have, and a comradeship throughout those 8 hours that we spend together. There'll be some cadavers, exciting work on pig jaws, and others as well. So, Dr. Carlos, tell us a little bit about the PRF scenario as well. That kind of sparked my interest. What do you teach there?
So over there, teach how you can handle the PRF in our office. If Dr. Wiedemann wants, we can teach the phlebotomy. We can teach how you can spin and create the sticky bone for facilitate the handle of the biomaterial for socket preservation or for sinulate, wherever you want. And we can teach that for sure. And I will show some case, and then I will talk about the new discoveries about the PRF, but not about the PRF. Our focus on this course is more about the thermal extraction and simple extractions, as Dr. Wiedemann said. I think that's the most important for all of the doctors, all of the, not only GPs, but even for periodontics, because they do many procedures like that daily, and then they need to know the basics of these procedures.
Excellent, excellent. That's lovely. PRP, PRF are getting very big in the industry, and it would be good for doctors to be able to get their initial sort of a crash course intro through us of what it is, what it does, how it works, how they can save, not only financially, but also with bone grafting, and also be able to facilitate a more rapid healing. Dr. Javid, there's a little video about the Excision Academy. It's very short. Could we kind of play that so they have a feel of what it's going to be like? There'll be some cadavers, healing. Dr. Javid, healing. Dr. Javid.
What do you guys have? Sorry, Dr. Shah, I'm having it.
I'm gonna go ahead and play that video if that's all right with you.
Perfect, thank you.
Oh, there is no sound.
You're not hearing the sound?
No.
No.
Okay, let me. That is odd.
But anyways, in this video, we will show that we will work on pig jaw, and then in another course, maybe we can have a possibility to work in cadaver, and then that will be great for our students. What do you think about that, Dr. Wiedemann? The first time we can start doing the first course in pig jaw, and then the second course we can try to bring cadavers.
Absolutely, I'm absolutely with you, Dr. Morao. The possibilities are endless.
Yes.
We need to make sure that the foundation is set. That if we work with, let's say, human cadavers, I think that's really for the advanced dentist. I think for to teach the basics, which is part of this course, we are doing really well with the pig jaws.
That's right.
Questions can be answered and the techniques can be introduced. And having this in mind, yes, then for those who are ready to take the next step, yes, a course in cadavers and about implant placement and all these kind of regenerative techniques, that would be, of course, much better than a picture.
Yeah, for sure.
With you.
Absolutely. So again, so we're having this special course with Excision Academy, 2 sessions coming up this year. And if Dr. Shah, can you share that flyer for us one more time? Also, we have a special for the members of become a member of Academy of Oral Surgery. That we have a special coupon code for that.
Together. So basically, they would go to the registration page at extacademy.com. That video we were going to play for you is here. It describes sort of the experience that you can expect to have. Under the registration, you click that and you simply go in, you register, you can put in your code. And at this particular on July or September session, and you can put your code in to benefit from that discount, which Dr. Javid just described. If you're an AOS member, which is free for your first year. AOS 2021 is the code for that particular registration. And we look forward to actually seeing you guys all on site. It's great fun. Not only do we teach each other and learn from each other, but a lot of the individuals that have attended our Excision Academy workshops over the year are now participating in other projects with the Global Summits Institute and are also helping us expand the doctor-to-doctor movement. And it becomes a very nice networking opportunity as well with the vast outreach that we have. This is one of 26 projects of the doctor-to-doctor movement. And hashtag doctor-to-doctor will find us on any of the social media platforms that are mainstream, like Facebook, Instagram, LinkedIn, Twitter, hashtag doctor-to-doctor. So that's it right here, Doc, the flyer. And I look forward to seeing more and more of our colleagues at these workshops.
Absolutely. And again, this course, it does cover all the oral surgery techniques and post-operative and pre-operative, basically complications and management. And it also applies to everyday dentistry as well. So it gives you a wide understanding of how to look at or what to look at, say, for example, CBCT, and looking at different images of of X-rays or panoramic X-rays, and where to look at, and basically know the knowledge to be able to educate your patient, and know how to obviously manage the situation if you have that emergency, you know, or when you should refer the patient out. And I believe this is very, very insightful and educational course that I recommend every general dentist should take and use. Well, and thank you so much, Dr. Wiedemann, and
Thank you, Dr. Javi.
Dr. Carlos, for taking time on a Sunday coming out. Dr. Shaw, thank you very much. We appreciate you guys very much, and I can't wait to see you guys on that day. You know, it's going to be exciting. You know, haven't been out for a while, right? So that'd be great to see all the dentists and the big crowd again sitting in a class together.
It's exciting too.
David,
Thank
very
you so
exciting.
much, Dr. Javi. Yeah.
Thank you, gentlemen. Have a great weekend.
Yeah.
have a great
Take care.
weekend.
Bye bye.
Sunday. Goodbye,
Bye.
everyone.
Have a great day. Bye bye.